My name is I'm Dr. Bor Chang, the CEO and co-founder of kelaHealth. For centuries, the way we've practiced medicine is to treat patients when they're sick. But 2 years ago, a team of Duke surgeons, statisticians, and engineers asked ourselves, what if we could flip that paradigm around? What if we can identify who our sickest patients would be and be able to prevent them from becoming sicker? This is what kelaHealth does in surgery. So there are 51 million patients who get surgeries every single year, and 15% of them on average result in complications. So millions of patients in the US are suffering complications every year, yet we know that half of them are avoidable. And so the US is spending $45 billion every year on avoidable complications alone. kelaHealth uses machine learning to be able to predict whether a surgical complication will happen before it happens. And then we allow surgeons to intervene with the best practice, high-impact interventions that are suited for that particular patient. Over time, as we learn which patients benefit the most from which interventions, we're able to disseminate these best practice guidelines to other surgeons in the hospital and to other hospitals. Our team is an interdisciplinary mix of surgeons, clinicians, leaders in the healthcare space, and broader surgical network. We have experts in applied machine learning and entrepreneurs with a record of success. We are a team uniquely positioned to build this solution. So the way it works is we have a group of patients who comes to us, the hospital, with a mixed bag of high and low risk. And we don't do a good job of knowing who's who. So we tend to blanket the same interventions to all of our patients, essentially treating the average patient. This is a low efficiency, high cost model. But as we're moving to an era of precision medicine, kelaHealth can accurately risk stratify our low-risk patients from our high-risk patients, reducing many of the unnecessary interventions we're doing for our low-risk patients and targeting our high-impact interventions to those patients we're most worried about. So this creates a paradigm of tailoring treatment plans, reducing costs up front, and improving patient outcomes down the line. And we're integrated right within the electronic health record, right within the surgeon's workflow. So starting from the initial consult through surgery to the time of discharge, we can be a guide along the entire patient surgical journey. So we've gotten a lot of traction from hospital systems, from accelerators and investors. Our pre-seed round is currently open, and we're aiming to close that round in the next few weeks. And we're interested in talking to investors who are excited about this mission and eager to join our team. Thank you so much for your time.